At Hampstead Aesthetics, our temple filler rejuvenation treatment is done with Vivisi Steelized dermal fillers. Now, we often get asked who is suitable for temple fillers. Well, it's really based on the assessment of the patient. Often I'll see the patient's full face and I'm really assessing for areas of volume loss. And typically, when examining the face, you'll see these areas in some patients, especially patients in their mid-40s, 50s, slightly hollowed out. They've lost volume in that temporal region. Now, a consequence of that volume loss is actually laxity of the tissues of the mid-face, and often it increases their jowl. So you get that sort of area there that's increased volume. These patients who have got this hollow there are suitable for temple filler rejuvenation. We usually use a medium density filler. In terms of the technique, we use a cannula so it makes it nice and safe. We typically use some numbing cream beforehand just to anaesthetize the area that we're going to actually enter. Are there risks? Yes, potentially of bruising, swelling, but if we use small amounts of dermal filler, we tend to get a very nice result. Another one of the questions is really how long does the actual temple filler rejuvenation last? I would typically say about 9 months to about 12 months. We use a medium density filler and that's the sort of length of time it lasts. In terms of the aftercare, which is often what people are also worried about, there really isn't much in the way of aftercare. Often, I just will say no gym that day, but just regular massage a couple of times a day for the next 2 days.